The lieutenant governor is on a statewide tour to see how hospitals would be affected by Medicaid expansion. Today he was in Junction City, touring Geary Community Hospital. Over the past 2 months, Lynn Rogers has been to more than a dozen hospitals, from Garden City to Pittsburgh, and at each hospital he keeps hearing the same thing.
I've not had a single hospital board or staff that have said they don't want to do it. They really see the impact.
In Geary County, estimates show more than 900 people could gain access to Medicaid if it was expanded. Tara Stroda is a nurse at Geary Community Hospital. She said 7 years ago the county had one of the worst infant mortality rates in the state. Now that rate is cut in half. She says that's thanks to getting eligible women on Medicaid.
An opportunity for our hospital to do more services, provide more health care to our moms and our babies, but also to serve the population in terms of becoming healthier overall.
Many hospitals across the state are losing money when people without insurance come to get helped.
They don't have any insurance coverage and they have to pay out of their own pockets. In many cases that creates a problem for the hospitals and emergency rooms, because we end up not being able to collect any dollars on that, but yet we have to fulfill our mission.
And the lieutenant governor says he believes expansion could help fix that.
As Kansans, we've paid $3.2 billion to the federal government for everybody else's medical care, and we're not spending it on ourselves.
This wasn't the only hospital on the lieutenant governor's schedule today. He headed to Leavenworth after he wrapped up here. Reporting in Junction City, I'm Alec Gartner.
And today, Governor Kelly met with top Republican officials on the topic of expansion. House Majority Leader Dan Hawkins, who opposes Medicaid expansion, released a statement on the matter after that meeting. He says in part, quote, Medicaid expansion is like a lemon on a used car lot. You can paint it up and give it that new car scent, but it will never run right, end quote. Now, when legislators return next week, we'll have to decide whether to bring it to a vote or not.